Hello friends, let's discuss Miotics and Mydriatics. So Miotics are the drugs which cause constriction of the pupil. So they cause constriction of pupil. Okay. And Mydriatics are the drugs which cause dilation of the pupil. Okay. So what is the pupil? Pupil is a small aperture. Right here you can see this space in the iris through which we can see the world. So that small aperture here within the musculature of the iris and opening, that is called as the pupil. So you must have seen that the size of the pupil, it keeps on changing. So you can understand the iris is the colored uh, the part of the eye which is seen, and in the center of that you can see a dark hole which is the pupil. So size of the pupil, it decreases or increases according to the light. So pupil responds to light. You I hope you understand. I hope you know this. So this, some drugs, they can cause constriction of this pupil and some can cause dilation. So which are the drugs that I'll be discussing? So to understand that, we need to know about the structure of the iris. So I'll make just, if you are looking from the front, what you see is, it is a small aperture, and there is two types of muscles in the iris. One is what we call as the radial muscles, which are present like spokes of a wheel. All right. And then there are the circular muscles, which are present like this, concentric to the pupillary aperture. All right. So these two subsets of the muscles, they have different sets of receptors. Okay. So the circular muscles, it is it there is the presence of M3 receptors on the circular muscle. Okay, so circular is supplied by the parasympathetic division, and the neurotransmitter here is acetylcholine. So acetylcholine acts on these M3 receptors, and it causes contraction of the, or constriction of the pupil. Because you can understand, this is, if this muscle shortens, what it will do, if the circular muscle, it shortens, what it will do, it will bring this uh, the aperture will close in. So that will lead to what we call as meiosis. So you can understand the drugs which act like acetylcholine, or acetylcholine itself, or the drugs similar to acetylcholine, or what we call as the cholinergic drugs, they act as miotics. Okay. And the other set of the muscle, the one which we call as dilator pupillae, it has the alpha receptors, and the alpha receptors are sympathetic in nature. So they are stimulated by norepinephrine or noradrenaline. So whenever this dilator muscle is uh, whenever this alpha receptors are stimulated, what happens is, this dilator muscle, it gets contracted, and whenever this gets contracted, you can understand that this is the free end of the muscle. Sorry, this is the fixed end of the muscle, and the free end is towards the pupil. So whenever this muscle will contract, it will contract in this direction. So that will lead to opening of the pupil. So it will lead to dilatation, or you can say mydriasis. So this will be the new situation when the radial muscle is contracted. So that is the effect of norepinephrine, or norepinephrine like drugs. They will lead to mydriasis. All right. So you can understand the sympathomimetic drugs, norepinephrine like drugs, or the sympathomimetic drugs, they will be acting like Mydriatics. Okay, I hope this is clear. Not only this, there is one very important component in addition to these, that is the m- uh, the receptors present here on the ciliary muscle. This ciliary muscle, it also has the M3 receptors. So M3 receptors are present not only on the circular muscle but also on the ciliary muscle, which is present just around the lens. And this ciliary muscle, whenever this gets contracted, it will bring these two ends together. So what will happen? The zonules, they will be loosened. The zonules, because these two ends are coming closer, so the zonules, they will become more less taut. Okay, so what will happen to the lens? The lens become free, and the lens has a natural tendency to become more spherical. So whenever the lens, these zonules are not tight, the lens will become more spherical. This is the basic nature of the lens. So whenever you are pulling them apart, what will happen? The lens will become more flatter. Okay, so in case whenever you are giving a cholinergic drug, it will act on this M3 receptors, and it will lead to loosening of these zonules, and ultimately the lens becomes more spherical. And whenever the lens becomes more spherical, it can better focus on the near vision. Okay, so near vision can be seen, because you can understand that for near vision, uh, if you understand the lens diagrams, you know that it has to focus on to the retina, or the point of focus. So a object which is present near to the eye or the lens, what will happen is uh, its rays will be emanating, uh, or you can say they will be divergent. So to bring them to the focus, you require a more power. So that power will be provided by the more spherical lens. And uh, and normally for a distant vision, what happens is the lens goes towards the more flatter side. So whenever we are giving a cholinergic drug, the lens will be focused, or you can say lens will be in a position to cause more vision in the near side. And if we give the opposite type of drugs which block this, say for example, if I give anticholinergic drugs like atropine, or similar to atropine, the drugs if we give, what we can see is they will be blocking, they will block the M3 receptors, both at the level of the iris as well as at the level of the ciliary muscle. So what will that do? So in case of iris, when it is blocked, it will lead to dilation of the circular muscle. So circular muscle goes into dilation, and whenever that is dilated, it will lead to mydriasis. Okay, so there will be mydriasis, and the ciliary muscle, when it is relaxed, it will push these zonules apart, and the lens becomes more flat. So there will be a flatter lens in case you are giving a anticholinergic drug. Okay, and this situation is what we call as cycloplegia. Okay, so cycloplegia, that is the response seen with anticholinergic drugs, as well as there is mydriasis. So two effects will be seen with anticholinergic drugs, and similarly two responses will be seen with cholinergic drugs. There will be meiosis, and there will be near vision, or what we call as a spasm of accommodation. Okay, so these two effects, they cannot be separated, because the type of receptor involved in both of these is M3. And this M3 receptor, so whenever you are giving a cholinergic or an anticholinergic drugs, these two effects will be cannot be separated from each other. So that is one important effect which you need to understand. And in case of sympathetic drugs, you will see only mydriasis. There will be no cycloplegia. So in case if you require both mydriasis and cycloplegia, if you require say if you require mydriasis also plus cycloplegia, you would like to give an anticholinergic drug. Okay, and if you want only mydriasis, it is better to go for a sympathomimetic drug. Okay, so a sympathomimetic drug which is commonly used for this purpose is phenylephrine. Okay, so that is one important thing. Now, in which situation would you like to give mydriasis plus cycloplegia both? That is whenever you are going for refraction testing. So whenever we are going for refraction testing, there we require mydriasis with cycloplegia, because that will take away the factor of accommodation. And refraction testing is when you go for checking the number of your eyesight. So for that, we require an accurate estimate of the curvature or the shape of the lens, so that uh, we can correctly prescribe the spectacles. Okay, but if we just want to go for the fundal examination, you just want to visualize the fundus just for the retinal examination, you do not require cycloplegia. So there you can use phenylephrine like drugs which provide only mydriasis. Okay, so that is about mydriasis and mydriatics. I'll tell you one more thing regarding this. In case of atropine or anticholinergics, uh, atropine, the mydriasis is what we call as passive mydriasis. The reason being, uh, because here we are not contracting a muscle, we are relaxing a muscle. Okay, so there is a relaxation of the uh, this circular muscle. So relaxation of a muscle which is causing mydriasis, that is why it is called as passive mydriasis. While in case of phenylephrine or sympathomimetics, uh, in case of phenylephrine, the type of mydriasis which you can see is called as active mydriasis. Okay, so active mydriasis will be seen in case because there is an active contraction of the dilator muscle or the radial muscle of the eye. I hope that is clear. Uh, I hope this lecture helps you. Thank you so much.